Hello, everybody, and welcome to our webinar, Empowering the Rural Poor with Healthcare Knowledge. This panel was originally set to be part of the UN Commission on the Status of Women meeting in New York City in March 9th, but was canceled due to COVID-19. So we are presenting virtually to you today. Thank you to everyone for joining us from all over the world. My name is Dr. Michelle Parker, and I'm an adjunct professor of public health at Santa Clara University in California, and I'll be your MC for today's event. We invite you to ask questions and share your insights by using the chat feature at the bottom of your screen. We also ask you to keep your sound muted so that we can hear the speakers. Please send me your questions directly so that I can curate them for each speaker in the interest of time. Are we still muted?
It should be, but I hear some sound. Can you, please mute yourself if you're not muted already.
You can stay down here if you want, Manny.
Okay.
No.
Please mute yourself if you're not muted so that we can hear the speakers.
Yeah.
Susan, can you mute?
I am muting. Okay.
Okay, I will continue on.
Yes, sorry about that.
No worries. So today, as you know, there is an increased urgency to teach accurate healthcare knowledge as the COVID-19 pandemic rages across the globe. Many governments are spawning myths and lack an organized response. It is our moral imperative as healthcare educators to make sure all people understand how to take preventative action and how to care for themselves and their communities. The collaborative work you'll be hearing about today began with the goal of teaching young girls about puberty and reproductive health, to empower them to stay in school in order to create their own economic opportunity. Today, we continue this work with the broader goal of empowering young women to take ownership of their health and the health of their villages in rural Uganda. Our panelist speakers today all share the goal of empowering marginalized women and have put together a unique collaboration using our various skill sets and expertise. Our panel members include Mandy Sangera, an international human rights activist, Susan Stassi, the founder and CEO of Rose Academies, which is an EOSOC-affiliated NGO that empowers through education. We will also hear from Dr. Sylvia Figuera, a professor of computer science and engineering and director of the Frugal Innovation Hub at Santa Clara University. And then we will hear from some exceptional students, also from Santa Clara University, who are using their skills in public health and biology to develop culturally appropriate educational curriculum for the women who need it most. To set the stage for our event, and using the name and logo of Rose Academies, I'd like you to imagine growing a rose. If we imagine every impoverished woman in the world as a seed, she has the basis of what she needs to become a rose, but she needs sustenance from the world around her. Every seed needs the sun. The sun is education and access to healthcare, two basic rights that are not automatically afforded to all. The seed also needs water to blossom into a rose. As a professor, I see that water as academic student energy. Sometimes it arrives in nervous sprinkles before it really gets flowing, and sometimes it arrives as monsoons of inspiration and hard work. And most importantly, the seed needs nutrient-rich soil. That soil is the foundation of a worldwide community, everyone attending virtually today, who give to these seeds to sustain the roses as they develop. So to begin our panel, I'd like you to introduce you to our first speaker, Mandy Sangera. Mandy is an award-winning philanthropist, a community consultant, and global campaigner. With over 3 decades of experience, Mandy is often referred to as a global catalyst. She has been driving innovation, building strategic partnerships, promoting advocacy and programming in the areas of human rights, gender equality, accountability, and social justice. Most recently, Mandy spoke at the US House of Representatives for the 3rd year in a row, as well as the Davos World Economic Forum this year. Mandy?
Hi, everybody. Have I been unmuted? Yeah. Hi, it's a great honour to be speaking at Rose Academy's event again. I spoke at, in New York last year, and it was great to meet Susan, somebody that I met, and I was really passionate about supporting her cause because I was really passionate about empowering and supporting young people, especially people in Africa and Asia who have really been left behind. As we now are focusing on COVID and we're looking at the world that has changed beyond recognition, over 215 countries have been affected by this invisible virus that is actually having a real impact on everyone's life. And as we're sitting at home in the comfort of our own homes and the luxury of things that we have, I know that I'm actually one of the very lucky sort of 18 to 20% of the world who actually has a roof over their head, who has 3 meals a day, who has access to water, all those things that we take for granted. Because the people that we will listen and hear from today will tell you that actually they would do anything to have my life for a moment. So as we've realized that 134 countries are hosting refugees, 71 million people to date are being displaced around the world in camps and have been hosted in great countries around the world to be offered a new way of life. That very vulnerable group at this moment in time are living in refugee camps. They are living in very crowded places. They don't have the luxury of socially distancing themselves. Things that you and I might take for granted. Living in Britain, I'm incredibly lucky because actually we have something called the National Health Service, which is our free healthcare system. And it's a fantastic system. It's free for everyone, regardless of your wealth, your status, or your ethnicity. It is open and it's free to everyone. As we have been preparing and being the second highest country in the world with deaths due to COVID, it's been quite soul destroying because actually we have a great system, but there's been some real inequalities in Britain as well. Somebody who's leading on SG10, which is tackling inequalities around the world for the UN, I'm really passionate about tackling those social, economic, cultural disadvantages. In Britain, just last week, we had a report from our audit office that actually identified that if you are Black or ethnic, from an ethnic background, Asian or Black, that you are got more chance of dying from COVID-19. So that was quite shocking for me because actually I fall under that category as a woman from Indian descent. And it was quite upsetting for me to see that actually frontline staff, people who I know who are doctors and nurses who are going out to the front line every day have ended up losing their life to this invisible virus. But as I started talking to people around the world in recent days, they were sort of saying to me, Mandy, you know, I'm living in Africa. I don't even have access to clean water to wash my hands. I don't even have water to drink, never mind wash my hands with it. And then we're looking at things in India and other countries, in rural countries that are very wealthy in one aspect, but then there's no toilets and women are victims of violence just because they want to use a toilet. There are more mobile phones there are in India and in Pakistan than there are toilets sometimes. So we need to look at these and we need to tackle those inequalities. And we also need to look at that women have really suffered by the impact of this invisible virus. And actually the UNDP did a report beyond income, beyond average and beyond today. And it really talked about some of the stereotypes and the messages going out in the community. So where they were saying that 57% of people in the 20 African countries felt that drinking lemon water would cure COVID-19. That's not going to happen, because trust me, if that was going to happen, I think the president of some country may have actually decided to inject everyone with some lemon water, but that's not going to happen, I'm afraid. Sorry, I had to pardon the pun, sorry, but I had to get that in. And again, but it was actually really scary, because actually we're looking at people in Africa, 20% of them feel like they will not capture the COVID-19. It doesn't affect them. And then again, I was looking at the other day some issues where they were saying about the climate and feeling like because they live in a warm continent that they can't be affected. But actually there's no evidence and proof on that. So we need to look at this and talk about the real elephant in the room. And one of the things that I have done is actually campaign on women's rights and young people's rights for 30 years and counting. And one of the things that really upsets me is that climate change has a real impact on people. And people often say to me, but how will it? But it does have an impact. If you're a girl that lives in Afghanistan and your family is hit by the COVID-19 pandemic right now, they can't feed themselves, they don't have enough money. This comes down to lack of education, that actually they will sell their daughter for about £12 US dollars to buy a goat. They don't think that that goat is only going to feed them for probably a couple of days, or if you're lucky, you might stretch it to 3 meals or 4 meals, a meal for a week. If you empower an educated girl, she can work herself out of poverty. She can actually change her own destiny and her own life. So it's really important that we actually look at empowering young people. And what do we mean by that? That is about equipping them, giving them the tools to actually live the life that they want to live. There are so many things that are happening right now around the world, and I feel like people are saying to me that COVID-19 is a great equalizer. I don't believe it is, because actually it's affecting women. Women are left so behind. People with disabilities are left further behind. People in rural communities are left even further behind. And people, the rural poor, are left even further behind. So we really need to have that conversation today. We need to look at, you know, when I talk to people from the continent now who send me messages on social media, they're saying to me, Mandy, I'm not worried about COVID, I'm worried about having food. So if your Maslow hierarchy of needs cannot be met, whether it's food, warmth and shelter, you're not worried about this illness, because actually you're trying to survive for today. You're not thinking for tomorrow that actually this virus may affect you. So, you know, Africa has really been hit, and so has Asia. You know, a lot of countries shut their borders, they've shut down the shops, people have been put on lockdown, people have been socially isolating, and they don't want to isolate. So how do we support them? And I know that the UN and other great organizations like Red Cross and other organizations around the world are trying to provide food and put pumps in to help clean water and put in toilets and things like that. But it is really scary, because actually we know by washing our hands, keeping our hands clean, using gels, putting a mask on, is actually trying to reduce some of the risk to us. So what we really need to be doing now is actually looking at those inequalities and how do we make it a level playing field for everyone across the world, not just about COVID, but actually going forward, because actually we've got less than 10 years to achieve the UN Sustainable Development Goals around ending poverty, empowering the next generation, promoting gender equality. All of those things will happen in their own time. But what worries me is that actually Africa is so far behind that actually they're never going to achieve the Sustainable Development Goals, because if they don't have the basics of water and food or education, how can we make it fair? Because we can't. And we need to have a real open conversation. I'm looking forward to hearing about some of the things that we're going to talk about, health, and especially around women's health. As you all know, that I do a lot of traveling around the world and I do a lot of talks all over the world. Somebody who had a lot of gynae problems themselves, I would again like come back to that I was in a position to be able to pay for my own healthcare and go private because I didn't want to wait for the national health at the time. But if I had to wait, at least I could have had the healthcare that I could have had access to. But what I found really difficult was somebody that suffered with their menstrual cycle every month and couldn't get out of bed for the first 2 days because of all the horrible pains and really heavy periods. But if you live in a rural country, women don't have access to sanitary products. They don't have access to a toilet. They don't have access to clean water. So how can they have dignity? How can they be treated with respect when we don't even have, tackle such inequalities? I'm really excited and looking forward to seeing some of the really good, innovative, creative things that you guys have been creating, especially the young students, because I love learning from young people. As people know, I do a lot of hacks and I do a lot of great things about engaging with young people. But I'm going to leave it there because I know that there's always a lot of questions and I can talk about a lot of things, but I want to give everyone else a space at the table. I really want to hear from everybody else. But I am really looking forward to this debate and I will take questions. And I'm sure that there's going to be a Q&A at the end of this, and I'm happy to answer any question. People can follow me on social media, on Twitter and LinkedIn, and they can find me there, and I'm happy to answer any questions that people may have that they don't want to answer here today. So thank you, and I'm really looking forward to the debate.
Thank you so much, Mandy. We appreciate your inspirational thoughts. I'd like to introduce our next speaker on the panel, Susan Stassi. Susan is the CEO of Rose Academies, which is a globally recognized humanitarian agency that currently works in Uganda, East Africa. Since 2014, she has spearheaded campaigns on menstrual health and hygiene, gender empowerment, and advocacy programs for the deaf and disabled. A firm believer in collaboration and cooperative teamwork, her drive and determination have united multiple institutions of higher learning, as well as community-based partners, in the development of innovative technologies designed to improve education access for the most remote and inaccessible areas of the world. Susan?
Yes, good morning, everyone, or good evening for those who are on the other side of the world. Thank you so much for joining us today. I'm really thrilled, and I have so much to thank Mandy for calling me and inspiring me to develop this webinar for today. And I'm also the gatekeeper here, so pardon me for looking off to the side here for a minute. Mandy said so much about what we do and the needs. And so with that, this picture actually is where we beta tested, I guess it's over a year now, in a little village, Katwadi in Uganda, where we beta tested the Heady Help application program, which is was developed for teaching young girls about sexual development and reproductive health. And what's amazing about this particular photo is, well, these girls had never held technology in their hands before in their life. Now they are learning English, so that helped to facilitate this learning instruction. But the knowledge of just letting them know that physical change is normal was huge. And when I came back and I was talking to both Michelle and Sylvia Figuera, who professors at Santa Clara University, and they asked me what was the age of that child that asked the question, and I said, well, that was not a child, that was one of the teachers. So with that, next slide, please. So who are we? We are a small nonprofit, but we're small but mighty. And the reason is that we are really doing some fabulous work is because we believe in the power of collaboration. Together we can, which is our motto. Working in silos just doesn't work. And I am grateful for the help that we have gotten from Santa Clara University, Texas A&M University, our working partners, are the NGOs that are on the ground, and our government ministries that I have a representative online participating this morning. I am just thrilled that we have these dedicated individuals that are helping us to bring education into the rural poor areas. And our main mission and focus is that we teach so that communities will thrive and children will live. Next. So what makes us unique is because we do work in the poorest, most remote villages in the world that have hardly any modern conveniences. They lack safe water, which this seems to be always a standard in communication, but it's more than that. They lack electricity, and they have low incomes of less than $2 a day. What's happening is in our developed world, we think technology is the answer. Well, yes, it can be, but unfortunately, when you're living in an area in India or Pakistan or sub-Saharan Africa, and you're living in an area that has no electricity, technology, I'm sorry, is just not the answer. So how are we addressing that? We bring the classroom into the village. And we are, as you saw in that first picture, tablets that work well in low resource settings, that have information on there that gives accurate information, so you don't have to be talking off the top of your head, as unfortunately with community service or community healthcare workers, they're trained real quickly, and they are given the opportunity. I guess it's not opportunity. They are given the mandate that they are to be filling the need for lack of medical professionals, and this is not possible. You know, to be a doctor or a nurse, it takes years of training. So what we're doing is we're saying, okay, you know, this is true, but how do we bring accurate healthcare information into a rural area that does not have electricity or internet access? So we're training the trainers. Basically, what that means is we're taking our youth, our young adults that really have desire to do something with their life, and we're teaching them how to be educators. And it's a stepping stone. It's for career development. We're developing vocational centers, and this is huge. The deaf and disabled, they have been excluded from programs for generations. And we are not just teaching them about how to do hairdressing, for crying out loud. If they're so impoverished and they're living in these areas that have no income, how are they going to be able to afford to get their hair done? And as you see in this picture, in the lower right-hand corner, these are girls. They shave their heads, so there's no hairdressing to be done. So we are teaching them skills, vocational skills that are employable skills, and including computer literacy for those areas where they do have electricity, and teaching them how to be a seamstress. And so there are so many skill sets that they can learn that will be able to take into our next generation. And next, please. So we have 5 pillars to success, and I'm proud of the fact that we innovate. We are right in the heart of Silicon Valley, and we have access to innovation at our fingertips. One of the most important things, as I already mentioned, is collaboration. We firmly believe in the power of collaboration, and this was actually going to be our main topic at CSW. And as it's evolved, here we are in COVID-19, and So the power of collaboration has become that much more important. We have community-based programs that we include. We don't just go charging into a village and say, hey, we've got the answer for you. We're going to teach your kids and what marvelous things. No, these people have a life, and we are honored to be welcomed into the community, and we find out how can we help and what do you need, and let's see how we can achieve that goal. We adapt because flexibility is the number one plan B. It's critically important when you work in rural areas, because as I've learned over the years, you can't count on having the resources that you might be used to from the areas that you are from. And finally, we educate. And this is our main premise and focus is to educate. We don't feed fish, we teach how to fish. We don't bring in food, we teach how to grow. This is so important, and many of our organizations that are in high tech, they've forgotten that we need to offer sustainable solutions so that these communities can rise up out of abject poverty. Going in and teaching them how to develop a business plan is certainly not the answer. They need to be shown how they can rise up out of abject poverty, not to give them a business plan that says, oh, I'm going to start a business now. Next, please. So we work differently, and we've developed a complete educational system, and with the help of Santa Clara University and Texas A&M has helped by, they have in the last year and a half, 2 years, we've been having community service projects that are, oops, Randy, oops, we've got some people that, I'm sorry, that have been developing storybooks that address the multiple diseases, mental health disorders, NCDs that are all going into our educational system. It's a small little unit that works well with in low resource settings, works without internet access, and that we are still in development for this, but we are going to be, this is a primary portion of our Train the Trainers program, so that we can teach them how to access all of this information, and so that they can teach in the villages in the dialect that's spoken, and so that they can bring the message of healthcare, accurate healthcare, into the villages so that they can learn about the severity of untreated disease, and so that children will live beyond 5 years of life, that babies will live beyond 28 days. And this is such important information that has not been distributed into these rural communities for far too long. Healthcare is a human right, and it's our mission and focus to make sure that everyone has access to this information that they need to be able to provide universal health care. This is a big push right now, and this is critically important. The deaf and disabled have been forgotten for way too long, and this universal health care coverage, it needs to include everyone. Next. So I just talked about this library, and we are going to be having available on our website. I haven't done it yet, but this a ton of resource materials for those who are working in developing countries, and you're trying to find, there are resources out there, but what we're finding is the information is at a too high a level for these village individuals to be able to understand. And it's too complicated to translate into the language. And talking about translation, we have a problem if the community is illiterate. So translating into their spoken language isn't going to do much good. So we have all of this information and application programs that are been developed specifically with the village, the rural villagers in mind. Next. And so we have arrival of COVID-19. We all know the dilemmas that we're facing, the shelter in place, disruption in all of our activities, and on and on. But, and what's happened is we have an increase in domestic violence. The disabled are further excluded. HIV and immune compromise are unable to get their necessary medications. And there's interruptions in the vaccination programs. What the main problem we're finding is this misinformation and myths that seem to grab hold more so than accurate information. So next. So what are we doing? We are actually, we have some volunteers that are working because they live in those villages, and we have been able to supply them with information that they can get to their community members about the safety, the prevention, and we're able to send them our simple to easy to understand booklets on mental health and heart disease, diabetes. These are diseases and disorders that and PTSDs and the anxiety and asthma. I mean, all of these right now, COVID-19 is just like, take a number. We've got so many different diseases and issues that we're having to deal with that, you know, we worry about getting our family fed, and you know, and our understanding what are we talking about COVID-19? We just don't get it. And so we are really excited about the fact that we're teaching how to make soap, how to make hand wash stations. We are, as I said, distributing through our digital learning through social media and through our WhatsApp. And we're coordinating with the Ministry of Education and Sport. Thank you, Sarah, for being on our team to be able to get this education information out to these rural areas. Next. And so to close, basically, these are our primary programs that we have: the Train the Trainers, vocational programs, and our economic enterprise development. And all of these are the means of empowering our youth to be able to have hope for a better future, so that children will live and communities will thrive. And I think that's it. I think next is closer. Yes, yes, it's the Katwadi kids. Okay, and with that, I'll turn it back over to Michelle. Thank you.
Thank you so much, Susan. It's so fabulous to hear about all the wonderful work that Rose Academies is doing, and it's so fabulous to be a part of it. And our next speaker is also a part of it. I'd like to introduce you to Dr. Sylvia Figuera. She is our next panelist. She is a professor of computer science and engineering at Santa Clara University. Her research is in the area of performance evaluation and prediction, recently with a focus on energy efficiency. She is also the director of the Frugal Innovation Hub on campus, in which she leads the mobile lab and advises students working on mobile applications for underserved communities and emerging markets. She has published over 70 papers and has established collaborations with both companies in Silicon Valley and social entrepreneurs in the United States and abroad. Sylvia?
Hello, thank you, Michelle. Hello, everybody. Yeah, you can go to the next one, I guess. As Michelle was saying, I am a professor of computer science and engineering, and I lead lots of mobile projects for social impact. So this is my passion right now. So I truly believe that technology can help. I know Susan just said it's not, the solution for everything, but I think it can help. And since that's my specialty, this is what I've been doing for the last 10 years. Basically, assuming the fact that everybody has access to a mobile phone, or a lot of people do, even if they don't have one, there's one in the community or one in the house or a tablet in the community center. Using those mobile devices to actually get information and service to people make a big impact. So I have been doing this for a while now, and have developed over, 60 applications and donate lots and lots of codes to different people. So our goal mainly is to develop appropriate solutions. And there's two main challenges in that. One is to understand the real needs. It's really hard for us sometimes to understand what people really need in some places. And the other one is to deploy the system. If you don't have somebody on the other side actually taking what you have developed and putting into place, it's kind of hard to go to the next step. And the solution for that is collaboration. So we collaborate with lots and lots of organizations in different countries, and even here in California, to actually deliver the right application to the right need, and to be able to actually deploy the system. So I'm going to give you just some examples to show what kind of system we have been developing and how we have been helping to empower young people, basically, through the use of technology. You can go to the next one. Yeah, so just some examples. One of them is a ride-sharing system. Years ago, a student actually spent a summer in rural Uganda, and he came back saying, people have a really hard time getting a ride when they live in rural areas. And both the drivers, the taxis basically, were always idle. So he was a business student, and he told me, I want to go back and create an Uber-style system for rural Uganda. But, it has to be SMS-based. The phones don't have GPS, and it's a very different setting. So we basically developed a whole ride-sharing system for him. He got a Fulbright, went back to Uganda, and create this local company called Wakabi. And local developers actually took over our code and realized that just SMS was not enough. Illiteracy was a problem, so they added a voice module for the system. So basically, through the collaboration with a student that went there, lived there, understood the need, and the local developers were able to deploy a system that's helping now the young people have more business and make more money, and the rural people in the rural areas to actually get rides when they need. Because sometimes, you need to go to a hospital or something like that, and you can't find the ride. That's a problem. So this is the kind of system that we've been developing over the years, basically by working with somebody who either live there, has a company there, understand the real need. We develop an application that is actually appropriate. You can go to the next. Thank you. So another example of these kinds of solutions is a system that we built for community libraries, also in Africa. So there is a professor in Santa Clara in the economics department, Michael Kevane. He used to go to Burkina Faso a lot, and he realized that the illiteracy level was really high in Burkina Faso. So he decided to create community libraries with donations from books here in other places. So he built over 30 libraries, but he couldn't afford a library system because those are really expensive. Those library systems where you go to the library and you scan the book and you scan your card. So everything was done by hand, and the librarians were really busy with that instead of actually working with the kids, which was the main goal. So we decided to help him out. So we built a whole library system using just like a phone as the front end and the cloud in the back end, because that would enable the libraries to actually afford the library system. It has a simple interface so that the librarians could use it easily, and enable the librarians to do data analysis, know which books are missing, who is late, stuff like that, and which books are popular. So all that was basically enabled by the fact that people already had the phones. So that would make it inexpensive for the libraries, and the cloud system for that amount of data is actually really inexpensive. So this is another example of using technology and the fact that, you know, phones are very widespread to actually build a system that will enable the librarians and young people to be empowered and help the kids with books and reading and things like that, instead of working on a paper and pencil kind of system. And then some years ago, we started collaborating with Michelle Parker and in the public health department at Santa Clara University. And this was like a great collaboration for us. The public health students, and they have better access and they understand better what problems to be solved in the health area than we do, of course. And so partnering with the public health students, our engineers actually are able to come up with solutions that make sense for some places. And the first one we did, and Susan already talked about that, is Head Help, which was basically to educate girls on human health. This is a big problem. We already know that girls get their period, they get embarrassed, they don't know what's happening, they don't have information, so they stop going to school. So we formed this group with engineers and public health students to write this application that will just, you know, teach young girls about what's happening to them with, you know, little stories that actually had people that looked like, you know, young girls going to school, so that they could understand what's happening. So this was actually built with Kenya actually as an inspiration, because we knew some people in Kenya that actually gave us, you know, some of the information for that. But then Susan saw that and decided that it would be really helpful for Uganda, and she took it over, and that actually enabled, you know, people to really use it. So this would never have gone anywhere if Susan hadn't taken it to the field. So having this collaboration with somebody who is actually working in the field makes a big impact in whatever we do. Or otherwise, we're just being like writing software that would just go anywhere. So collaborating with somebody who has a way of taking this to the people who need it and can be empowered by that makes a big impact. So we can go to the next. With that in mind, we are just working on another project that is about actually saving babies. By talking to Susan, we learned that a lot of babies die in the first month of their lives. And then mortality rate is really high in sub-Saharan Africa for little babies. So we partner again with the public health students, and they're going to talk about this more. I just, you know, want to show that this is like the trend that we are going now. And actually, again, working with the public health students and Susan, we're able to actually take in these applications to where they can make an impact. Without these collaborations, we can write software, and that's not hard for us. But creating software that actually makes an impact takes having somebody to take this to where it can actually make an impact. You can go to the next. Yeah, that's all I have to say right now. I'll be glad to answer any questions later on. We have built over more than like 60 applications. Some of them have been deployed and are making an impact. And some of them, because we didn't have these collaborations that we actually have with Susan right now, actually didn't go anywhere. So I really believe in the power of collaboration, especially when you actually collaborate with people that know the field and know the people and know the needs. That makes actually enable the technology to have the impact that we are looking for.
Thank you, Sylvia. And now you're about to hear from some of our students that work with Sylvia and I to create these projects. Some very talented college students, although I may be a little bit biased because I've had the pleasure of teaching them for the past year. They are part of a year-long research course called Engineering World Health. And this course partners students studying biology and public health with engineering students who are working on their senior capstone project. These fruitful cross-disciplinary collaborations provide a unique learning experience for our students. It gives them an opportunity to practice research skills and presentation and writing skills, as well as practicing the all-important art of communicating across disciplines. So the first two students you'll be hearing from today are Tatiana Valentine and Tia Halsey. Tatiana is a senior biology major with a minor in public health. She has been working on projects like the one you are about to see for about 2 years now, and hopes to continue impacting the world through medicine after she graduates. Tatiana chose to work on the Umwana Thrive neonatal survival app after spending last summer in Rwanda working as a health and impact intern, wanting to continue her work with East African women. And just this morning, Tatiana learned that she was accepted into the master's program of global health at Georgetown University. Tatiana's partner on this project is Tia Halsey. Tia is a junior with a double major in public health and anthropology. She spent last summer working with environmental conservation and education nonprofits in Bolivia through SCU's Global Fellows internship. Tia is a community facilitator on campus and a program coordinator for the Santa Clara Community Action Program. She is continuing her work in public health this coming summer as an intern with the Santa Clara County Office of Education through the Valiant Goldman Public Health Leadership Program. So Tatiana and Tia.
Hi everyone, Tia and I are very excited to tell you about Umwana Thrive, a mobile health neonatal survival application, and our solution to preventable death of newborns in rural Uganda. So this year, our team came together to combine computer engineers, biology, public health, and art students. And we coincidentally are also a team of all women. So next slide, please. Every day in Uganda, 81 babies die, all within their first month of life. And so some of the main risk factors for this include being born premature in rural environments and to young mothers who don't have equal access to healthcare and education. Next slide. And so 1/3 of Uganda's women have a child before the age of 18, which is a huge contributing factor to the high number of death. Next slide. And so here are some main common causes for death in Uganda, which would be medical complications during birth, prematurity, and respiratory and gastrointestinal infections, just to name a few. Next slide.
So after our preliminary research, we decided that we wanted to concentrate our app on the first 28 days of a baby's life. The application features include educational modules that incorporate clear graphics and limited text in order to overcome low literacy rates. We hope that mothers will be able to see themselves or a friend or a family member in the characters that we have created. And given our emphasis on overcoming low literacy, we have relied a lot more heavily on the art to convey our messages as opposed to solely text. Next slide. So the schematic represents the main 3 features of our app. The first being the 3 educational modules discussing the topics of lactation, common sicknesses and illnesses, and general hygiene. I'll be giving more details about one of the first modules in a moment, but the other app feature is a resource map that gives information regarding local healthcare clinics and maternal child resources. And then the final feature of the app will be more on the administrative side and will focus more heavily on how healthcare providers will allow healthcare providers to message moms through the app via SMS. And the database will help clinicians communicate with mothers about vaccination schedules and appointment reminders, especially since our moms will be in more rural settings.
So this is the resource map, which is one of the features. And we decided to provide about 24 clinics to the new moms on this section. And actually, when we were first working on this, only one of the clinics actually had a Google Maps location. And so we had to get pretty creative to put a pin onto where everyone else was. And so we found that Facebook and other social media sharing sites actually were helpful in that endeavor. On the next slide is our messaging system, and that allows the healthcare workers and midwives to interface and communicate with moms about vaccinations, clinic appointment reminders, and infant healthcare concerns. Next slide.
So now I'm going to walk you a bit through our first module and some of the slides that we created. So these are some of the sample panels from the module entitled Feeding Your Baby, which is all about lactation. And this image depicts a community of mothers with the new mom pondering what is best to feed her newborn baby. And as we continue, this next slide, we are teaching moms that breast milk is the healthiest form of nutrition for their newborn, as opposed to solid foods. And we continue on with this theme, showing that it's important to feed your baby, again, only breast milk as opposed to milk from a cow or other animals or water, as breast milk is crucial for the nutritional content and immune system development of your baby. Next slide. And on this last slide we'll show for this module, we wanted to explain that milk production takes time, and as a baby grows, so will the mother's milk supply. This was to reassure new mothers and dispel worries that breasts aren't producing enough milk and nutrition in the first few days of life. The different stages of the baby's growth is associated with the larger volume of breast milk, and we wanted to show this slide as a great example of how the art in this application is able to translate the nuance of our messages without extraneous text.
So this is another module that we created called When Baby Gets Sick, which highlights important common illnesses and important healthcare practices. And so we just wanted to give you some sample images from that. So on the top left is talking about kangaroo care and infant temperature regulation. And on the top right, we are showing moms when to seek further medical assistance when their baby is sick. And then on the bottom left, we show malaria prevention and then treatment. And then on the very last one, it's showing moms to kind of comply with Ugandan health practices and get their babies vaccinated. Next slide, please. So we just kind of wanted to show this to show the partnership that we had with Rose Academies, which allows our innovative technology to be centered in their established community. And Awana Thrive is more than just educational. It aims to connect through the messaging system and the resource map to increase the community of care for these newborns, because we know that neonatal mortality is not just a rural Uganda problem, it's a world problem. Thank you very much.
Thank you.
Thank you, Tia and Tatiana, for sharing your project with us and for saving babies' lives. Our final two panelists today are part of a team working to develop a cervical cancer screening tool for use in low and middle income countries. Their contribution to the project focuses on increasing awareness and education of cervical cancer. And through their collaboration with Rose Academies, their educational brochure has arrived in Uganda and will be disseminated to rural villages as soon as those travel restrictions are lifted. So I'd like to introduce you to Lauren Sherry and William Nelson. Lauren is a junior at Santa Clara with a double major in public health science and economics and a minor in biology. She was an Ignatian Center Jean Donovan Fellow in Peru, working as a public health intern with VIDE Peru. She is a community facilitator and an intern at the Marcola Center for Applied Ethics. Lauren is passionate about global health and plans to pursue a career in health economics. William Nelson is a senior with a double major in public health science and biology. He is a Hackworth Fellow at the Marcola Center for Applied Ethics, and his project focuses on the intersection of sexual health and healthy relationships. Next year, through the Jesuit Volunteer Corps, he will be working as a health educator and community advocate for the AIDS Community Resources Center in Syracuse, New York. So with that, let us begin with Lauren and Will.
Thank you so much, Dr. Parker, for the introductions. Will and I are extremely excited to present to you our cervical cancer education brochure. This is a trifold brochure that is currently in Uganda. Cervical cancer is a global problem, as it is the fourth most frequent cancer in women globally and 90% of cervical cancer-related deaths occur in low and middle income countries. The main risk factor for cervical cancer is the sexually transmitted disease, human papillomavirus, also known as HPV. In order to screen for cervical cancer, there are multiple options currently available. Most common in developed countries is the Pap smear. However, in many developing countries, other options are also available, including the visual inspection with acetic acid, known as VIA, and cryotherapy.
So we were very fortunate to have developed a strong partnership with Rose Academies because they're doing great work in Uganda. We were able to build upon Rose Academy's sexual health curriculum by adding information regarding cervical cancer. We chose to focus our attention on this issue because of the high prevalence. According to the World Cancer Research Fund, Uganda ranks 7th globally for the rate of cervical cancer. So after reflecting on this reality, we decided to use our public health background to work towards better health outcomes. In line with structural competency principles, we created the brochure that addressed basic information around the disease, which could be distributed to healthcare workers, clinicians, and communities. We mostly use images to convey the information, so literacy would be a minimal barrier. To address the social determinants of health, we incorporated the theme of women empowerment. Ultimately, we hope that the brochure will lead to a better understanding of the disease and a greater sense of community. So, as you can see on the screen, this is our first image. We chose to use this image to help provide a basic understanding of female anatomy. It's important to start here with biology so we can effectively understand cervical cancer and how to prevent it.
Throughout the brochure, we followed a storyline between our main character, the girl in purple, and our Senga, the woman in pink. The Senga represents an auntie figure who provides sexual and reproductive education while also supporting our main character in order to best protect herself from cervical cancer. In this first prevention strategy, our main character is a young preteen receiving an HPV vaccine. Our next panel demonstrates a split image, the Senga giving our main character, now older, condoms for protective sex. Our second image portrays a man and a woman about to have sex. This image was a challenge as we were trying to be sensitive and respectful of cultural and religious norms. Finally, our last preventative strategy is VIA. This is the primary screening technique in middle and low income countries for cervical cancer. This technique uses a swab with acetic acid to streak the cervix for precancerous and early cancer lesions. It is recommended for women ages 25 to 49 to get screened about every 3 years.
Central to our mission is recognizing that everyone is a part of this issue. Traditionally, cervical cancer was understood as a woman's only issue. However, men play a critical role through carrying the human papillomavirus. Oftentimes, the infection will be asymptomatic in men, demonstrating that men should be equitably informed. To demonstrate what community involvement could look like, we have our Senga teaching the community. This is important because she's the expert on this topic, and she has the best interest of the community in mind. Our final image of the story represents the power of community. The image shows the main character becoming the Senga for another girl. We wanted to show how advocating with others can have a domino effect throughout the generations. This is what we hope the future will look like as we address these global health challenges through education and empowerment.
Thank you. We've come to the end of our speakers. Thank you, Lauren and Will, for sharing your cervical cancer brochure with us. I am watching the chat box and I'm not seeing any questions right now. I will give it a moment for some to come in, or we can close in the interest of time. And I'm leaving up our email addresses here so that you can contact us for further collaborations and also to get your questions answered. So to close, I'd like to thank all of our speakers who attended today and shared your work with us, our participants and our listeners for taking the time to join us today. We appreciate your feedback and your camaraderie during these challenging times. I'd like to wrap up with a quote from Susan Stassi. Thousands upon thousands of lives are being changed every day when we give the gift of knowledge. Every human being deserves to have an education, and we are making sure that happens. So thank you to everybody here for helping us to empower rural women, helping seeds to become strong, healthy roses. Stay well and have a good day. Thank you.